Mon nom est Louise Holt. Je suis directrice générale dans le secteur des partenariats pour l'innovation en développement.
Good morning, everyone. I'm Louise Holt. I'm Director General for Social Development Partnerships.
Really thrilled, as everybody else has said this morning, to be here to give us an opportunity to step out of our day jobs and reflect on where we've come from over the last while, where we're at, and where we're going forward, how we're going forward. Today's discussion is on equitable partnerships. I just checked, that's the title. Just a couple of logistical things before we jump into the substance of the discussion. First of all, comme c'était le cas pour le
Similar to this morning's plenary, the proceedings will unfold in English, but I do invite you and encourage you to ask your questions in the language of your choice in either French or English.
I hope people are using. Small housekeeping issue. I see some people have water. If people are wondering where to get water, apparently it's just outside the room on tables outside, so you have to actually go out and get it and bring it in, so please feel free to do that. So I am really thrilled to be here this morning with a diverse set of panelists to talk about equitable partnerships. I think we were set up really nicely this morning by the discussions, and particularly the last discussion that Julia is sort of presenting the conference discussion paper and talking again about Margaret and John's paper on the SDGs and the North Star. And I'm also really pleased that Margaret is here to listen in on the conversation. I promised her I wouldn't put her on the spot, but will encourage her thoughts and engagement on this. I think that it does set out again for us that common vision of the SDGs, where we all want to get to, both in Canada and in our work in supporting poverty eradication efforts, and particularly in the health and development sector globally. So the SDGs is a vision. Carolyn, in her comments earlier today, also spoke about needing to do things differently. That the Feminist International Assistance Policy sets out an approach that recognizes that if we're going to get to 2030 and achieve our goals, we need to do things differently. We need to bring in new partners, new funding resources. So this is a really, the issue of partners and partnerships is going to be really key to getting there. We, all of us, I think, working in this space, whether in Canada or internationally, know that partnerships are essential. We know that if we're going to do better, if we want to amplify the impacts of our individual actions, we need to work in collaboration with colleagues working in the space. But most importantly, we need to work with from the outset of all of our efforts with those that are our intended beneficiaries. And they're not just beneficiaries, they need to be real, true partners in the process. That's central certainly to our Feminist International Assistance Policy. We know, and we have had for a long time as part of our gender equality policy within global affairs, that women and girls and adolescents and youth need to be part of the process from the outset, and stakeholders in decision-making processes that impact them. But we also know that we haven't actually gotten there in terms of processes that actually work. We've talked about that a bit this morning in the context of youth and adolescents and how we engage them, and it's not just a generic consultation process. We need to think about how we can do it in a more meaningful way. So we've got three great speakers with us this morning that are going to jump into that, bringing three different perspectives, I think, to the partnership discussion. Really pleased to have, let me just flip to, did I bring my bios with me? Oh, I didn't bring my bios. Okay, I might have to get people to bring their bios. So I have, and I think in order, we have I think Colin is going to go first. Colin Beckworth, who's currently the nutrition technical advisor with Nutrition International. I do remember from reading my notes previously. So Colin brings an interesting background, having worked both in Canada and Indigenous communities as well as in developing countries. And he's going to talk a little bit today about the experience with partnerships in Indigenous communities. Oh, thank you, Jessica. Awesome. All right. Do the official. Said currently a technical advisor, Nutrition International, over 15 years of experience in global health, including 5 years with Doctors Without Borders in DRC, Central African Republic, and South Sudan, some pretty tough environments. 5 years working in programming, monitoring, and evaluation with the Liverpool School of Tropical Medicine, and 3 years in Arctic Canada with the government of Nunavut, working particularly on maternal and child health. So as I was saying, I'm going to be talking about some of the experiences, what partnership means, and some of the challenges that we're struggling with in terms of developing equitable partnerships in Indigenous communities in Canada. We then have Josh Berman, who's with Dignitas International. He is their director of their Ideas to Impact Lab. So I'm going to really put Josh on the spot and ask him to talk about some of the sort of bringing innovation to partnerships and what that means and what that looks like in all of our practice. Josh also has 15 years experience in international health and development. Most recently, he managed Dignitas's research and knowledge translation program in Malawi. He oversaw the implementation of innovative and high-impact clinical and health systems research, as well as the development of Malawi's knowledge translation platform, an initiative to support evidence-informed health policy making. Prior to returning to Canada to join Dignitas in 2010, he served as the Associate Director of the Lesotho Boston University Health Alliance, where he directed a team in the development of Lesotho's first postgraduate family physician training program, as well as a clinical quality improvement program at Lesotho's Northern Regional Referral Hospital. So quite a diverse experience. And then finally, we have Dr. Diego Bassani, who is the Director of the International Program Evaluation Unit at the Centre for Global Child Health at the Sick Kids Hospital in Toronto. He currently leads a multi-country, large-scale evaluation, conducts research and offers technical support to international programs in the area of maternal and child health in multiple countries. He's a scientist at the Hospital for Sick Children and an assistant professor at the Dalai Lama, I can never say that. I always want to say Dalai Lama School of Public Health. He received an MSc and PhD in epidemiology from the University Federal de Pelotas in Brazil. And apologies, my my Portuguese is not up there. He's conducted a really important research on causes and distribution of child death in India, identification of risk factors for child mortality, and impact of policy changes in child health, survival, and development. Those of you that know Diego know that he has been a super active member of the CanWatch community and a real thought leader in pushing us to think about how we do data collection, results. He's been part of getting the initiative that Helen talked about earlier around the research collaboratives up and running and off the ground. And I am going to put him on the spot for the role that he and colleagues at Sick Kids have been playing as embedded research teams in certainly in many projects, certainly 5 of the projects that we are funding through Global Affairs for our partnership for strengthening maternal, newborn, and child health. So Diego and colleagues at Sick Kids, and I'm looking at Stan, bring a really interesting perspective, I think, over recent years in new approaches to partnerships. We've been really excited to have that kind of partnership approach, to have real collaborative coalitions of people that are working to advance our programming, and want to hear what that has looked like and where it's going to take us. So I'm going to turn it over to the speakers. We'll hear from you, I think, and then maybe come back and look at what we've learned from those different perspectives. What are some of the conditions for success, to quote from a conversation I had at the break with Margaret Biggs, that we're going to need to really move effective partnership forward to achieve that vision of the SDGs and advancing our feminist international assistance policy. Try my technical skills here. Nope, that's me. Colin, over to you, and you should have some slides if all goes. Up to you if you want to sit and. Okay.
Great, thanks. So thanks very much. My name is Colin Beckworth, and as you ably introduced me, my background is that I've worked in global health for around sort of 15 years as a nurse with Médecins Sans Frontières and at the Liverpool School of Tropical Medicine. But what I wanted to do, and currently with Nutrition International, as a nutrition surveillance technical advisor, but I wanted to sort of draw on some of the lessons that I sort of learned whilst working up in Nunavut in the Canadian Arctic for this session. So, during the time I worked with the government of Nunavut and the Department of Health, one of the projects that I managed while I was working there was carrying out a situational analysis to generate some of the ideas and recommendations for a new maternal and child health framework for action. I'm sure many of you have sort of carried out those similar kinds of situation analyses. We set out a process for sort of stakeholder consultations and desk review, fairly standard. But from the start, one of the things that we wanted to do was try and make sure that this project was culturally safe, and that cultural safety was really foremost in this project. So, just as a little sort of recap for those, perhaps if those who aren't so familiar with cultural safety. So cultural safety is a concept which really came out of health worker interactions. And from this document, sums it up quite well, I think. So within an Indigenous context, it means that the educator, practitioner, professional, whether Indigenous or not, can communicate competently with a patient in the patient's social, political, linguistic, economic, and spiritual realm. But in addition, I think very important, so the National Aboriginal Health Organization states that the cultural safety moves beyond the concept of just cultural sensitivity to analyzing power imbalances, quite crucially, institutional discrimination, colonization, and colonial relationships as they apply to healthcare. So now, as I say, we made the sort of conscious decision from the start of this project that we really wanted both the process and the recommendations to reflect cultural safety. But as I say, it's a concept that sort of originated around interactions between healthcare workers and patients. And so there's quite a lot of literature, there's a lot written about that. But what we were trying to do was sort of develop policy recommendations and develop policy. And what we found was there was not quite so much, there's very little guidance, in fact, around sort of developing culturally safe policy. So what I'd like to do is sort of describe for you now our attempt at sort of trying to achieve that. So some of the first steps that we took were within sort of the government itself, so ensuring consultation with other departments that were more focused on cultural safety, such as culture and heritage, ensuring that it could be carried out the health worker consultations, that they included Inuit healthcare professionals. One of the sort of key steps was having a mixed Inuit and non-Inuit working group that led this project. And having sort of cultural safety as a standing point on our weekly progress meetings. Because our challenge was really to sort of try and turn those high ideals into concrete actions, which is a very complicated thing to do. And so that was a very important step to have it as that standing point so that we could keep coming back to it. It gave us the space to keep revisiting and rediscussing that challenge every week. So another measure that we took was working with the Kauyiatit Health Research Centre. I hope that you'll excuse my bad Inuktitut pronunciation there. But they carried out consultations across the territory with mothers to find out what the mothers wanted from the health services. Now, QHRC, as it's more commonly referred to, is a world-class, produces world-class sort of Inuit-led operational and academic research, and it's based in Nunavut, quite crucially. And I think that one of the key things is the knowledge, the experience, the skills, and importantly, the cultural lens that they brought to that consultation process was really quite invaluable, and something that we didn't have within our working group. Thirdly was working with sort of territorial and regional Inuit organizations and wider civil society. NTI, so the Territorial Inuit Association, was a standing member of the supervisory sort of committee for this project. But we also were trying to seek out other ways that we could find to sort of to make sure that cultural safety was represented in this process. So, for example, we designed a session where jointly with NTI we could sit down and review the findings from the Truth and Reconciliation Commission against the sort of the process and the recommendations. So this was about a year-long process. And what were the sort of the take-home? What were the things that I found that we sort of learned during this this process? Well, I think the first thing is that meaningful consultation through partnerships is really is essential to culturally safe policy, and meaningful partnerships are essential to meaningful consultation. But in none of it. We have to recognize as well that it's not just the right and the useful thing to do to consult, it's also mandated under the Nunavut Land Claims Agreement, or the Nunavut Agreement as it is now, under Article 32, which states that Inuit have the right to participate in the development of social and cultural policies and in the design of social and cultural programs and services, including their method of delivery. But as the 2015 NTI report points out, this is made more difficult by the fact that there are no currently guidelines for actually implementing that and what means sort of meaningful consultation. So the second thing that I felt that we learned was that the partnerships were really essential to this process. And as the Indigenous Physicians Association of Canada states, so only those receiving the services can affirm cultural safety. So a central tenet of cultural safety is that it's the patient who defines what safe service means to them. So moving that over to the sort of the policy lens, we felt very strongly that once the project was finished, it wasn't for us to say whether that process or the recommendations were culturally safe or not, but because of working with the Inuit organizations, we were able to sort of go back and have a meeting to sort of grade our process, grade our recommendations, and actually came up with a sort of a framework to grade what we had done. So, and I think the third sort of process and the third lesson that I sort of learned from this, and this is, I think, more what I'm sort of like taking forward as well into my the current work with NI, is that turning high ideals into concrete actions is very complex. I am not, I hasten to add, the person who comes up with the high ideals. I am the archetypal boots on the ground guy who gets your project done for you. So I'm always looking for how I can take those high ideals and actually change what we are doing in order to sort of to represent those high ideals. So creating a safe space for discussion really gave us the time to sort of gain understanding and build trust between organizations. So for example, the meeting with NTI to review the sort of the TRC recommendations, while extremely worthwhile in its own right, was equally as valuable for the conversations that we had around and after that meeting and the building of trust that we had there. And so creating an environment such as our weekly progress meetings, where as a mixed group we could come together and have cultural safety as a standing point on the agenda, where we all felt secure enough to sort of say, I'm very committed to this idea, but I'm not quite sure yet how we're going to turn it into action, was extremely important. And I have to say, it took quite a few Monday morning meetings that we had to go through where we had no ideas whatsoever. We then had to have quite a few Monday morning meetings where we only had, frankly, bad ideas before we actually got to the Monday mornings where we started to have some good ideas, which is not just an observation that I would sort of make, but also when we sort of came to that validation process, I think we all came to the consensus that we'd had a very slow start. I think because of our sort of lack of guidance. But by the end of it, on our scale, we were sort of rated as towards the top. So success took time, and it took time to sort of build in that time for discussion. So thanks very much. I'll cede the microphone now. So thanks very much.
Okay. Thanks very much, Colin. Josh, over to you.
Sure.
We'll just jump in.
Maybe my comms people won't be happy, but is it okay if I?
Absolutely.
Great. It's funny, maybe 2 quick points to start, is that I feel like each time you do these panel sessions, the number of years of experience you have grows, and you're just getting older, and 15 is 20.
I was actually trying to figure out with, you guys are talking about 15 years, I'm like, that probably pushes you to that upper end of the youth category.
Right. And you round up with those things.
Exactly.
Thanks for that introduction, and thanks for that initial talk. And just to say that it's nice to represent some colleagues here, both from Malawi, where we've worked for 15 years as Dignitize International, and a relatively new partnership over the last 4 or 5 years with the Sioux Lookout First Nations Health Authority up in Northern Ontario. So I'd like to talk a little bit about, let's say, a case study on a relatively new, and I'll throw in the word innovative, partnership modality or model. And that's really, hopefully, an activated network that's linking peer-to-peer policymakers, researchers, stakeholders, practitioners that are facing common barriers to achieving health outcomes, but are geographically dispersed around the world, and how we're going about doing that. So I'll talk a little bit about how we're doing that, and hopefully a little bit about what's working. Maybe can I start, it's been a couple minutes since the break. Can I ask everyone to stand for a second?
Awesome. Does that mean us?
Yeah, why not? Okay. So just to get a sense in the room, maybe sit down if your life hasn't been touched by non-communicable diseases, whether that's cancers, let's say diabetes, hypertension, cardiopulmonary disease. Right. Okay, now we can all sit down.
Okay.
So just to make the point that I think that what I'm going to talk a little bit about is really a huge driver of premature mortality and morbidity around non-communicable diseases. I want to pick up a little bit about what the earlier sessions were talking about around the MDGs and around the Sustainable Development Goals, and really that we feel as part of our network that the MDGs focus exclusively on low and middle income countries, really echoing some of the earlier points, and that it really reinforced these traditional north-south power dynamics. And it really brought the global north as somehow the purveyors of knowledge. In addition, we would argue that the MDGs really excluded those that it was really meant to engage, whether that's First Nations and Indigenous populations here in Canada or other excluded and underserved populations around the world. And we believe that these SDGs, now that we're working in, again, as echoing before, represent this universality development framework, and give us a chance to form new partnerships that are based on what we're calling this multi-directional knowledge translation, where we're taking evidence and experience and best practices from one location and applying it to others in a contextualized manner, no matter where that evidence is generated. So we formed over the last 3 or 4 years an innovative network of policymakers, practitioners, civil society members, researchers, who are all aiming to drive more inclusive and equitable non-communicable disease policy, practice, and strategies. And we've based this on a collaborative knowledge generation and translation framework that I want to talk a little bit about. Importantly, one of the foundational principles of this network is who's at the table and who's driving this work. And I would argue that the KT Peer network, this network that we have formed, our research and knowledge translation agenda is driven by those that it's meant to serve, and it's Indigenous Canadians and other excluded and underserved groups. And you can see who we have at the table, and this network is constantly growing. Right. So what are we doing and what's working in our approach? And again, let me just say it's relatively early days, but we do think that this model holds some promise. So this is our collaborative knowledge generation and translation model. And I'm just going to walk you through it quickly, and I apologize if it's somewhat small, but I'll walk it through as a case example. So we're currently exploring in all of those previous geographies that I showed, the use of equity indicators within non-communicable disease surveillance systems. And this is across high-income countries, such as here in Canada, middle-income countries, Brazil, and low-income countries through partnerships in Malawi and Uganda and elsewhere in Southern Africa. We're also exploring what's the nature and extent to which indigenous, excluded, and underserved populations are involved in developing these non-communicable disease surveillance systems, as we feel historically that these initiatives tend to exclude from the development process the very people most affected by the health inequities. So first, as a global network, we're generating evidence in the development and use of these equity frameworks by documenting best practices from the world. We know they're out there, and we're now working through that best practice documentation. Then our network, again, made up of policymakers, researchers, civil society members, are developing knowledge translation products, such as evidence briefs or curriculum, that we can take these global best practices and contextualize them to individual geographies and places where we have stakeholders within the network or members within the network that are really well placed to take this work forward. What I think we're doing here really is generating global evidence that we feel then can be contextualized and used by our members locally. And that's really, I would say, the push of the innovation here is that we're not developing evidence that's contextualized from the beginning, but really looking for commonalities across geographies, but where barriers are similar, and then allowing our members to contextualize those and engage in policy processes at a national or a subnational level. So this initiative that I'm talking about aims to strengthen, at least initially, country-level non-communicable disease surveillance systems so that they illuminate rather than mask inequities within populations. And I think this is what we've seen here in Canada, we've seen in many countries around the world. With that unmasking of these inequities, that's I think, a root piece of foundational evidence that you need in order to enable evidence-informed priority setting and policy and practice changes that ultimately we think can reduce health inequities. So we believe this partnership model holds some promise. It focuses on collaborative knowledge generation across geographies. It promotes inclusion as a core concept that runs throughout this network. And we think that it can fundamentally shape and improve, in this case, how non-communicable disease strategies and policies and programming is designed and delivered, but we do think it holds some promise outside of the NCD world also. In brief, let me stop there.
Okay, excellent. Thanks very much. Yeah, great. Okay. Really interesting, and I think there's probably some areas there we could drill down in terms of the just the Indigenous. I'm looking at the i2ilab.ca. Is that Indigenous to Indigenous?
It is not.
Oh,
okay.
Okay. Yes. We'll come back and drill down on that. But let's first hear from Diego.
All right. So I actually don't have any slides.
Okay.
And I'm going to talk a little bit about something I saw this morning, and I think it serves as a good analogy to the type of work that we're doing. Louise mentioned that we've been working with 5 organizations for, I think, 3 or 4 years now. And we've been continue to learn. And so this morning, as I was flying here, after I had a cab with a flat tire on the 401 in Toronto, but the flight was delayed, so everything worked out. I sit down and I was trying to do a little bit of work and started watching a documentary at the same time, which was for some weird reason about a guy trying to learn how to solve a Rubik's Cube in 60 seconds while jumping from a plane, tied up to another guy who would be responsible for opening the parachute, and that was the time he had. Like when the guy pulled the cord, he was supposed to have finished the Rubik's Cube. And I think there's, as weird as that is, and I don't know why someone sponsored that, but it is apparently some sort of TV show. I was thinking that there's a lot of similarities between what we do when we do international assistance work. And we're not very far from being jumping from a plane trying to solve a Rubik's Cube. But the difference perhaps is that I think we have a backpack full of taxpayer money, and it's open and the money is flying out as we fall down. So if you keep that image in your mind, I would hope that it would help you rethink your work and try to understand what could be done differently. So we're not solving the problems while the money is flying out of our backpack, and we may hit the floor at the end and if the parachute doesn't open. But that doesn't seem to be part of the issue for the guy trying to solve the Rubik's Cube. But we're doing very complicated things at a very fast pace, and perhaps we're putting the time pressures applying them and on the wrong spots. And if we could switch things a little bit, we could achieve much more. And I hope that part of this conversation will allow us to talk a little bit about that. Like, how can we reframe the way we do international assistance so everyone in the partnership, including the local governments, which seem to be, from what we've seen so far, much more removed from the equation than they should be. And the reaction to attempts to be included or to include yourself, as sometimes the governments do that, like on their own. Like the push comes from local government. And one example is Tanzania, which has recently stepped up a lot their engagement with NGOs working in the country. And I've seen a lot of reactions that are along the lines of like, oh, this complicates things a lot because now we have to bring someone else to the table and like rediscuss our programming. And maybe that is what we should never be thinking. Like, that should be the beginning of the conversation, is sitting down with the local government and think about what type of program is needed for the country. And that's what feeds into what Global Affairs Canada or any other funder decides to do in the country. So I think by moving the pieces of the puzzle around a little bit, we can land safely with a solved Rubik's Cube, and perhaps our backpack is still closed, so we haven't started spending the money while we were falling. So I'm happy to start talking and answer questions, and yeah.
Okay, perfect. Thank you. Okay, interesting. And I can admit some days, my days, I'm sure all of us have days like that where you feel like that's kind of what your day is, right? You're trying to solve the Rubik's Cube of jumping from a plane and hoping the parachute's going to land. How do I get from here to the end of the day? And hopefully everything falls into place. So some interesting concepts, I think, around partnerships. Going back to my original points around keeping that kind of conditions for success in mind, I'm going to spend a few minutes just asking the panelists a few questions to probe a bit more on what they were talking about, and then we'll open up the floor for discussion. So maybe just sort of going back in order, Colin, I mean, I think you introduced a really interesting concept around cultural safety and the work that you were doing in Nunavut in that area. So let me just ask you, I mean, to probe a little bit more on that. I mean, what does that mean, the concept of cultural safety, what does it mean for meaningful consultation? Colleagues talked a little bit about that as well, and even Diego just now, sort of at the local level. So what does that mean for us more broadly in our development work and programming that we're doing, but also for the work that we may be doing in Canada? You also talked about that it took time, right, the extra time. So what does that mean for how we set up programming, our programming policy frameworks? And I say, us collectively, including government. So what are the conditions for success to allow that to happen or build that into programming? So sort of two questions there for you.
Okay, so thanks very much. So, I think I want to sort of pick up first on what you were saying about sort of like meaningful consultation, because meaningful consultation is something that we know that we need, but then try and define exactly what that is. So, I mean, I was speaking about meaningful consultation in terms of sort of Nunavut and in terms of fulfilling our obligations under the sort of the Article 32 of the Nunavut Land Claims Agreement. I think the 2015 NTI report had quite a damning sort of verdict, where they said undervalued and underutilized opportunity for cooperation and partnership among Inuit, the GN, the Government of Canada, partly because of an interpretive approach that was minimalist, that was unconvincing, unsustainable, and at odds with the general sweep of both domestic Canadian and international norms. And to the relations in relation to the rights and roles of Indigenous people. But went on to sort of, and I think that this is sort of generally regarded, is that what really sort of held it up was that, as well, is that there's no currently accepted guidelines for what constitutes sort of meaningful consultation. And so, although it's enshrined in the Nunavut Agreement, and there seems to be a lot of good work going on with people trying to sort of carry out consultation, there's no accepted standard, which leads to a lot of reinventing the wheel as well. I think that one of the, or a couple of the sort of the key sort of things that I took back from that was to go back to the that confirmation exercise, that cultural safety can only be affirmed by people receiving the services. And so I would suggest that sort of meaningful consultation has to be affirmed by the population that's being consulted. And that's certainly what we tried to do in that process, was at that final sort of meeting to sort of review our process and our recommendations, was to say, do you feel that we have carried out our obligations for meaningful consultation under Article 32? I think another sort of key sort of point was having a local sort of Inuit-led research centre. I was very interested to see recently that ITK has recently brought out a research strategy. That's the ITK is the National Inuit Organisation, with sort of 5 key points. They want to sort of advance Inuit governance in research and enhance the ethical conduct of research, align funding with Inuit research priorities, ensure Inuit access, ownership and control over data and information, and build capacity in Inuit Nunangat research. One of the sort of, I think that the key advantages we had was by working with QHRC, was that they could really sort of carry out a meaningful consultation through that cultural lens, because my background is more sort of towards data and numbers, but I had it was a real masterclass in me for me in qualitative consultation, in that surprisingly people don't give you their views in nice, neat anthropological snippets contained in paragraphs with a reference list at the end, and it takes quite a lot of sort of work and a lot of cultural knowledge to sort of to translate the views. So I think that those were sort of two of the sort of key concepts that we kind of got from that. In terms of how does that sort of translate to sort of the broader context, and how does that impact on my work now, and what are the factors for success? Well, we've been doing a lot of thinking about this, because I'm now, as I say, working at Nutrition International in their sort of nutrition surveillance group. I'm currently working on sort of revising our M&E toolkit. One of the revisions that we're making to that is to really promote gender equality in the way that we collect data. So again, I'm finding myself in a situation where I have to sort of change the way that we work in order to implement truly implement a cross-cutting theme, and one in which I am by no means an expert. I think of gender rather like my car. I have one. That does not mean I am an expert in it. So the first thing that I sort of kind of realized that what we had to do is to go back to the lessons that I'd learned from this process, which is to sort of identify my key partners and then build in the time for discussion. So starting within my organization, who are those key partners that I can sort of discuss sort of what, build that space for dialogue. So what sort of kind of gender mainstreaming means, what are the language around it, what are the aims around it, and have that dialogue then sort of to say, what does that mean in terms of survey statistics, which is what I'm kind of sort of dealing with, so that we can build a sort of common understanding, build sort of trust, and really then sort of take those high ideals and turn them into practical actions. Because I think for me, a truly a true partnership means that I will change the way that I am working on account of having that sort of interaction, having that partnership. So if I haven't changed anything, then is that really a true partnership?
Okay, super, thanks. So I heard, I think some really interesting points that there isn't an accepted standard, and that we maybe too often are all sort of, when we're starting out, all trying to reinvent the wheel. And so maybe some opportunities there for learning and sharing, but recognizing that also that there has to be the need that it needs to be affirmed in the local context and by the population and the groups that we're working with. That heard local led and aligned with local priorities. And Diego, that aligns a bit with what you were saying. Let me on that point. Let me jump to you, Diego, a little bit around that and the complex kind of sort of scenario that you pointed out to. I mean, if you're looking at collaboration amongst multi-stakeholders, and maybe taking that out of just the ensuring the local context is met, but what does it mean sort of for all of us as we're collaborating? And so the work that you've been doing with different partners as part of the CSO community, but also and then funded by Global Affairs. I mean, what does that mean for all of us in terms of our collaboration and partnership, and still being responsive and working in partnership with the local needs? It starts to get pretty complex bringing in all of those various players.
Yeah, I think that building on what Colin was saying, that if you're not changing the way you work, then this is not a real partnership. I think that's a good starting point, because on one hand, it could mean that it's a very easy partnership because everyone's on the same page, but we generally are not. And although I think that the list of priorities is the same, the order of the items in the list is not necessarily the same. And that's understandable. We have different pressures. Like Global Affairs Canada has a pressure from the government and a political pressure to deliver certain programs at a certain time and to be able to have results at a certain date. So that can feed into the political cycle that we cannot ignore in any of the contexts, and that's understandable, and that is probably something we cannot change. But perhaps what we can change is get everyone aligned in terms of what is the ultimate goal of what we do. From investing in international assistance, the objective is to change outcomes at the community level. From an organization that is implementing a program, that should also be the top priority. It's not to complete a financial report back to Global Affairs Canada. And sometimes we get entangled in the complexity of the whole process of receiving assistance and delivering a program, and also having to be accountable for our resources, that I think we lose track of what is really the end game, and which is this something that will happen to that community that will improve their health and their well-being, or gender equality, some aspect that our programs are focusing on. And that's where bringing in the local government, I think, helps everyone center. It's almost like marriage counseling professional that will, okay, I understand that you're perhaps coming from slightly different positions, but what I need is to improve school attendance for girls in my country. And I think when we get to that point where we accept that that's the conversation which should be happening, we can reframe our programs and we can make this sort of polygamous relationship work, because everyone, although has to attend to different, perhaps, needs of other partners that are all entangled in this web, we can also find, okay, the common thread and try to make that the priority while we also try to answer all of our other questions. But I think if we can get everything aligned, then we will be changing the way we work, and we can have partnerships that are actually meaningful and that will lead to a result. If we get together and try to pursue our own goals while pretending to be on the same page, we'll not get there, and it will be frustrating for everyone. So I think we need to be more honest and start having those conversations like much earlier than what we usually do. Like that usually happens when we're in a crisis, and it needs to be part of like the planning of the program, and perhaps even the planning of what a call for proposals is going to be, with a much more heavy, like, let's say, technical component, or a technical part of the work that happens on the side of the government or the funder, instead of pushing it to the organizations, because you start having too much spread and too much risk going on from that perspective. So I think that changing things a little bit could result in much more meaningful partnerships in the future.
Okay, I'm not sure I totally followed that last point, so can I just unpack that a bit? So you're saying using a call for proposals, for example?
Right, yeah.
I mean, so at
like
the
any
early
funding mechanism.
but at the early setup, right? If you're looking at sort of on the funding side, you were saying to have government funder, I'm assuming you're sort of meaning in that case, do more technical upfront work.
Yeah, so for example,
set out the parameters, or?
Right, and I think that happens in some, at some level, like more in some investments than in others, but like when you're working with a specific country and there's going to be an investment in a specific country, that's a conversation that happens with the local government to understand priorities and to try to align the international assistance policy with the needs of the government. But I think that the missing piece that would perhaps simplify a lot of the work of civil society would be to move a technical component that is expected to be done by the implementing partner in the design of the program and alignment of that program with the priorities that were identified in this initial conversation, and to come out with just to use the call for proposal as a simple example, something that is much more contained and much more specific about exactly what you expect that will happen with that investment. I think that will be much more palatable for the organizations. I may be wrong, and people can raise their hands after and say if I am or not. But you change the balance of decision making to where I think it should be, which is with the local government that is receiving the investment and the funder who is giving the money. And the amount of time that you're going to save by doing that is quite considerable, because you can engage a much more cohesive group of technical support if that's not available in the organization, to just streamline the decision making about programming. And then once you release the funds, what's happening is implementation of something that you know and understand what it is. And at that stage, certainly know what kind of impact you should be expecting from it. It's almost like you're telling the story that you need to tell the Prime Minister's office at the end of the funding cycle. You're anticipating that and knowing what you're going to get, because we have evidence to support the programming. So we could do that in reverse order and simplify things.
Okay, so I'm hearing, I think you're picking a couple of interesting points to pick up there. Again, going back to the sort of the concept of conditions of success, sort of that goes back a bit to what Peter Singer was saying this morning as well when we talk about results and outcome, right? So start with how are we going to tell the story, or what's the story we're going to tell at the end of the day, and results to help and make sure we're set up from the beginning to be able to tell that story. And I think that's a really interesting proposition. You also hit another point around sort of the role of government funder versus down to sort of the implementing partners into the local government. And I think that picks up another interesting point. And Josh, I'll turn to you to maybe to pick up on this a little bit around the collaboration around multi-stakeholders who may have differing views and agenda. I feel like too often we set ourselves up a little bit as an us and them. I'll speak just a bit from recent global affairs perspective and from a partnership branch perspective. So many of you are members of organizations that Global Affairs has funded, and we work with you. And recently, in the last few years, we have made a shift ourselves in terms of how we view our partnership with you. Those of you that have funding will, and even some of you that don't, will be familiar with the concept of partnership leads. So we've tried to move away from just, we're funding you, so I'm the responsible project officer for your project, to actually thinking about a partnership relationship and how we work with your organization, and recognizing that all of your organizations do work that goes beyond just a project with Global Affairs Canada, and that you're all an important part of the broader Canadian civil society community working in this space. Many of you, as we've heard, are increasingly working in Canada in Indigenous communities as well as in the Global South. And we recognize that we need to better take advantage of that and be more strategic about how we work with you to ensure that we're, from a government perspective, we're aware and, yes, taking advantage of that broad wealth of knowledge and expertise that is part of the Canadian CSO community, but that we're also playing that leadership role in connecting, facilitating, amplifying that broader work. That can take the form of a project, and I think maybe that's where sometimes we get stuck when it's a funding partnership. But then, what does that mean, sort of from a broader partnership perspective? And I think I've seen, all of us, it is a bit of a shift in how we're working and a change. And both those of us, inside Global Affairs, aren't necessarily always comfortable or have a common understanding of what that means. And I think outside as well, people aren't necessarily, we're not yet there in terms of what that means. So, Josh, you particularly talked about your initiative brings together policymakers, researchers, stakeholders. So how is that dynamic playing out in that context? And what are the conditions needed to make it work and bring all those competing interests together?
Thanks for that. And just to say, we really appreciate that approach. I think if this was easy, we would have done it by now. So just to say that it's, when you're bringing a multitude of stakeholders together, we obviously see tremendous potential and benefits and have started to realize that. But the more cooks you have in a kitchen, the more difficult those conversations can be around finding commonalities and pushing forward together. For us, what partnership means, and I'll speak from an NGO lens, we go into partnerships hopefully relatively humbly, especially with working with partners, Ministry of Health and Indigenous Canadian-led organizations, that we're learning as we go. And we have some experience. We think we bring value to the conversation, but that we're learning. I think also one of the pieces that a core concept that we've really tried to get at as we've formed these more complex partnerships is around what role, let's say, Dignitas can bring, an NGO can bring, and are we driving the agenda, which I think is more historical, or are we allowing, as you've said, others that have that are stakeholders in governments and live on the land? Are they driving the agenda, and we're providing some evaluation support, some technical assistance? How is that partnership modality developed, and how is it really implemented? Because I'm always interested in people's thoughts around the room. I know that we've been asked, and we've probably asked in the past, for a letter of support 24 hours before a proposal is due, and that's the tokenism that we're really trying to move away from. That we're not forming partnerships so that we check many boxes and that we look like we're inclusive, but really trying to allow those that should drive agendas to drive them. And that may mean things take different, we have a strategic plan as an organization. We think we're headed this way, and when we're forming partnerships where we're not leading, that may move us in directions that we're uncomfortable with or that we didn't foresee. But I think that's that's for us to be uncomfortable and have some creative thinking around how we can continue to add value in these types of partnerships. And that if you look historically, I feel like there's been too much driving from an NGO lens, and I think especially working in quite complex settings and with multiple stakeholders, that we need to take a look at how we can provide value without driving all the time.
Okay, great. I'm going to put one more question out to the three of you and leave to you to respond, and then we're going to turn to the audience. We have a hard stop at 12:15 for lunch. Also, always very important. But I've been told by the organizers it's a hard stop, so we'll be getting the signal. I want to have opportunity to talk. I mentioned earlier as well, sort of innovation and wanting to bring that in. Going back to this paradigm of we know we need to do things differently. We know we need to bring in new partners and new resources to achieve a 2030 agenda. So we have a world where organizations, individuals that have been working in the space, very experienced, struggling with partnerships and established relationships. How do we bring new players in to this already complex environment and do it in a way that is helping us to move the bar? And what does that look like? I don't know whether you've had experiences. I mean, we talk about bringing non-traditional partners in or innovative partnerships. Maybe that doesn't necessarily mean does not necessarily mean new people or new partners. Maybe it just means doing things differently, but probably a little bit new partners and new networks. So have you seen examples of that working? How are we going to do that? How do we reach out and bring new partners to the table in this already complex environment?
Yep.
Thoughts?
All right, well, I'm happy to jump in quickly. I think one of the areas that we've explored and are still exploring is our engagement with the private sector and what we can learn from the private sector. I mean, one of the issues, and this has to do more with some of the work that we previously have done and continue to do in Malawi around injecting evidence into policymaking processes, is we had a community of practice that was focusing on pharmaceutical supply chain management. If you go anywhere in Malawi, and I'll say anywhere that I've been in the Global South, Coca-Cola is really good at supply chain management. You see signs everywhere. What can we learn from them? How do they what's their processes? So we've brought them into a community of practice and engaged them at a country level around how can we learn and what can we take from business supply chains in talking about pharmaceutical supply chains in a country like Malawi. I think there's still barriers to that engagement being really meaningful. There's some hesitation on both sides, or let's say on all sides. There's more than two sides of that coin. But I think that does have some potential to continue to be explored as one innovative way. The other piece is around. I'm really passionate about, in Canada as a leader in this, is around integrated knowledge translation. So really engaging the people that you want to have make changes from the beginning and continuing that engagement throughout the process. And again, that goes back to tokenism and getting away from that, but having true, meaningful engagement in the development of research questions and the development of programs from governments that you ultimately want to adopt these policies. And I think there's ways that we've shown that works. There's lots of pitfalls and ways that we still struggle, but I would say those two are maybe two core concepts anyway.
Okay, Colin.
So I think what I'd like to add to that is not necessarily a role for sort of new partners, perhaps sort of a little bit of repurposing, perhaps. One of the sort of things that we built on after the sort of MCH framework for action work was then looking at the role of cultural safety, for example, in monitoring and evaluation. So monitoring evaluation is very much kind of my bread and butter, and I'm very familiar with sort of results-based monitoring. But if you are setting the results, then you are basically defining success. because I'm English, I'm contractually obliged to put in at least one Winston Churchill quote, which is, I intend to come out on the right side of history because I intend to write it. And sometimes M&E can feel a little bit like that. There is a huge power imbalance inherent in M&E, on top, compounding sort of, the power imbalance that, is written about quite extensively in the literature about Indigenous health. So one of the things that we tried to sort of sit down and sort of thresh out was, well, what does culturally safe monitoring and evaluation look like? And partnerships, again, very key in that. A cultural lens, again, very, very key in that, because the sort of, as QHRC are sort of often sort of said to me that they do research that focuses on an Inuit way of seeing and an Inuit way of interpreting the world. So taking account of that as well to sort of change the way that we do monitoring and evaluation to make it a more 360-degree kind of process that means that we can then self-reflect as well on what we have done. And get people's feedback on what we have done, rather than say, okay, well, we've hit our targets, and great, we can send off our report saying that we've met a criteria that we've set ourselves.
Nice.
Yeah, I also think it's not necessarily about bringing new players. I think it's about changing positions a little bit and like moving the pieces around, and you can get the streamlined process out of it. And it's like, I was surprised when you said, oh, this is quite different, like this idea of moving the technical component of deciding on like what types of programs are going to implement it to perhaps like the funder side or the earlier in the process. But when we think about decisions about health programs that we implement in our provinces in Canada, that discussion happens at the provincial level. Like, the government invites technical experts to consultations, and the decision about whether we'll introduce a new vaccine or change a screening program for a certain type of cancer happens at that level, and then it's like divulged to the local, like to the health providers to implement the program. So there's, like, if it requires training, there will be training delivered, but it's standardized and it has been decided in advance. No one here would think that you could decide to fund a new cancer screening program and just said, we need a new breast cancer screening program. Each health organization, each service provider can decide what they're going to do, or I'm going to choose 3 or 4 who are going to implement the programs in the country, and you
Give
can
us your best proposals and we'll take it. Yeah.
Yeah.
Okay. Very interesting. So learning across different contexts and different experiences, and we've had some interesting perspectives across this. So now over to the floor. I see at least one person there. I see Jan. Oh, people starting to get it. I'm just going to put out, as people are running to the mic, I'm hoping that we might get some youth perspectives in the room. Helen,
Less
I think
than 15 years.
Yeah, I'm like under 35. Yeah, we'll try to get through. So, okay, lots of questions or comments, questions. Youth perspectives. I'd also be remiss if we don't put out. I mean, we heard Peter saying, we're at a situation where it's not okay that we're not, including Indigenous communities and people in decisions that impact them. We have had lots of great discussion in this sort of #MeToo era too, that it's not okay that we're not engaging women. I think the motto of the Adolescent Health Conference last year, Helen, I'm looking to you, was not for me without me. Or something to that effect that we heard from the youth. So welcome any perspectives on that as well. But with that, I'll turn to Jan at mic 1.
Clearly, I'm not you.
Yes.
So my question starts with to Josh with regard to the equity focus on health evidence and research. Are you looking at that research through an equity lens using, systematic review processes like Progress, and are you also looking at the impact with regard to equity? So about, I don't know how many years ago, we did this multi-country study looking at not just how do you measure the investment in research, but how do you measure the impact on equity? So that was my question. Then related to that is the drilling down for data so that you can assess more than outcomes and results, because we're not talking about impact, we're not talking about effectiveness, and in fact that's what we really need to be talking about ultimately. I know we do look at the stars, but we also want to look at what is the impact, not just the outcomes and the results, and that's where we'll get at the equity effectiveness. Yeah. Thanks.
Let's take questions in groups of 3 so we can have time to...
Since there's so many questions and I already had a chance at the podium, I'm not going to ask a question, but I'm going to issue a challenge, because there's a word that I didn't hear from any of you, which is feminism. So, I mean, in this day and age, with the Me Too era, with the Feminist International Assistance Policy, the first thing that I think of when I think about equitable partnerships is how would you take a feminist approach? So my challenge is, in answering that, to ask you, how do we take a feminist approach to partnerships, and what would that look like?
Thank you, Helen.
Thanks.
Fawad Akbari here. I work with Aga Khan Foundation Canada. I just wanted to pick up on Josh's point about private sector role and ask a question. I agree with you. I mean, there's a great potential in private sector that perhaps, in my view, we haven't tapped, we haven't used. They are more efficient than us. They are more innovative than our sector. They have the resources that we haven't used to most extent. And to your point, Josh, they're also smarter in penetrating the market and reaching to the consumers and clients. I traveled to northern Mozambique or northern areas of Afghanistan in a very far valley, walk for several hours, and there's one shop and unhealthy commodities are there. Coca-Cola, cigarette is available there. So the question is how private sector can take these commodities there, and we can't take health services and commodities there. Yeah. So that's the question. But my question to the panel is that maybe with concrete recommendations. So what do you recommend Canada should do moving forward to use this kind of potential of private sector? Not only from the financial resources that they have, but how can can Canada lead? Can Canada be the convener? So maybe with some reflection and recommendations from the panel.
Okay, let's quick pause and respond to those first 3 questions. Josh,
okay, the first question, thank you very much for that. I guess I touched on this a little earlier. I think it's, we're now 4 years into this KT peer network. I think we're talking about impact, but we're far from making any. I think we're still in early stages of knowledge generation, and then our model will try to take that down. To answer your question around systematic reviews and the progress frameworks, yes, I think we have taken a mix of different ways of knowing, whether that's theoretical or indigenous, and tried to take the best and all approaches to kind of where's our focus amongst a broad network, and then how we take that forward. I'm gonna push back a little bit on your private sector. My sense from what you were saying is it's kind of the panacea or the answer, and I think, I would argue that they're not necessarily more innovative or smarter. They could be selling a product that may be more easily consumed, and maybe more easily transported than a health system strengthening approach. But I do think that we're also trying to tackle really complex problems that go beyond getting a soft drink in someone's hand. And I think that the private sector should have a role, and I think we want to harness what the benefits are. But I would push back a little bit to say that I don't think that's necessarily the full missing link. I think there's ways to engage better, and I think we're trying to do a little bit of that. I know others in this room are doing more, but that's my thought.
Okay. Yeah.
Thanks very much. So if I could perhaps respond to the feminist question there.
I think gender came a couple of times.
And my answer to that would be in terms of sort of the work that I am currently involved in, and I'm not quite sure yet. Ask me back in 2 years, and I will give you a full report back, because that sort of process that I sort of set out of getting partners and creating dialogue and understanding aims and understanding sort of language is, as I say, now one that I'm sort of trying to use to apply to the work that I do. Now, the work that I do at Nutrition International is towards the nutrition surveillance. It's a lot of surveys and a lot of statistics. So what I'm now sort of tasked with doing within the team is to try and sort of take that feminist approach and apply it to the work that we're doing. So that is that's going to take a lot of some time, I think, on our part to sort of to have build in that space for dialogue, to sort of say, well, okay, what exactly do we mean by feminism? What exactly are the aims of feminism? And please sort of give me that safe space to discuss that as a non-expert. And then sort of to look at then what we do in terms of data and figure out, well, okay, if your sort of long-term aim is this, our aims are that, let's see what we can do to sort of to fit those together. Now that's, again, and I always come back to this, is sort of trying to take some high ideals and turn them into concrete actions. And the sort of the litmus test is, well, has that actually changed what we've actually done? Now, I know that sort of around gender, there's a lot of talk about sort of gender disaggregated data. I think it's more complicated than that. I think there's a lot more to it than that. I think that to really get to sort of the that underlying sort of the basics around what we do in terms of monitoring and evaluation, in terms of sort of surveillance, it's going to take longer to have those conversations and really figure out, well, you know, I don't want to just play lip service to this. I really want this to be a meaningful interaction, and that's going to take some time, and it's going to take time to build trust, to build a common framework and build a common language. And I'm sort of at the beginning of that process at the moment, I think, but we're very sort of committed to it. So, as I say, please invite me back in 2 years and I'll report back.
Okay, we'll hold you to that. Okay. Any thoughts? Let's go back to the mics and take the next round of questions as we're getting close, of course, to time. I thought we had lots of time, and now we're coming tight.
So I'm Peter von Doudelson. I'm a Kiwi-Canadian who now lives in the UK.
Okay.
I'm an obstetrician, so if I'm not a feminist, Helen, I should give up my job. I think it's the art of applied feminism. My comments about, two comments about equitable partnerships. One is, for much of the global south, they can't actually see the North Star, they see the Southern Cross. So, because I'm a Kiwi, it's on the flag. So just to remember
Fair
that.
point.
So the illusion is resonant for a Canadian audience, but maybe not to many people with whom you're trying to discuss. The other partnership is actually around discovery science. So I'm a academic clinician who actually still does molecular and cell biology, but also does implementation at scale. And that's a pipeline of discovery and knowledge generation through to implementation that many people in this room probably aren't as aware of. You live at the other end of the process. And until we start strengthening in-country discovery science, and so that the knowledge generation that is pertinent to that community is strengthened, whether that's in the north of Canada or in the global south. You know, I can give you a great lecture about the origins of preeclampsia. It's what I do, but I can't tell you that the pathways to preeclampsia are the same in Malawi or in Pakistan as they are here. And until we know those details, and until we have local people who can generate those details, we won't be as helpful as we ought to be.
Okay. Give me that one. Okay. Josh wants chomping at the bit to talk to that. Thank you very much. Some interesting points. Next,
Hi, Melanie Gillespie from World Vision Canada. I just wanted to bring the conversation about equitable partnership back to something interesting I thought that Kathy Lee said in her address. And it was that Canada must acknowledge our history of colonization and unresolved relationship with Indigenous peoples. And I was just wondering, is there a similar conversation that needs to be had sort of in the development space? Are we having it? Should we be having it? And what does that look like?
Okay. Yes. Thanks. Question 3. We've got one more round quickly after this. Yeah.
Hi, my name is Ali Matudimoni Kenny, and I'm actually an anti-FGM campaigner and a women and girls' rights advocate. Okay. And two parts to my question, starting with building partnerships. And I know the speakers haven't spoken so much about intersectionality, the older woman, the trans, the LGBT. Where do they fall in that? So perhaps a way forward might be to look in building partnerships there, because I think it's quite important. And my question is, because I think there are two panel speakers that have worked in Tanzania, I heard earlier. In Tanzania, again, back to the partnership where a major stakeholder puts a policy that affects a beneficiary. In the case of Tanzania, pregnant teens were banned from gaining education. And we know from the type of work we do with pregnant teens, early and child forced marriage, girls who are early educated could be better mothers in terms of accessing health services. So what are the challenges you find for those that have worked in those areas, particularly in the South?
Okay, thanks. I'll just say, so for those of you that are at the mic now, we'll answer these questions quickly. This last round, there's four more questions, and then wrap it up. So just ask that no more people come to the mics, and that those of you that are there think about how you can concisely ask your question. So some quick thoughts on that. You were quite...
Yeah, sure. I really appreciate your question. I'll try to be really brief. So at Dignitas, we believe that you need innovative programs, but then you also need the people that are going to develop those programs, but then also carry them through. And they need to not be from sitting here in Ottawa or where I sit in Toronto, but they need to be from the places where the programs are to be implemented. I'm going to give a shout out to the new initiative that we're launching next month is the I2I, which stands for Ideas to Impact Lab. Its dual purpose is to its dual purpose is to inject innovation into global health thinking, global being the world, but then also to empower that next generation of leaders to take those innovations forward. And we're really trying to allow space within this lab for young next generation of leaders to bring forward the problems that they're seeing in their community, and for us to give them mentorship, some supportive, some salary support, some implementation budget. I mentioned mentorship, and to leverage those relationships that we've held over 15 years with partners to allow them to leapfrog their innovation and their growth in their career and their capacity forward. So that's a model that we're trying to take to address some of those key concepts that you mentioned around getting local ownership of problems and the capacity to deal with those problems.
Okay. Any other thoughts on intersectionality, policy making, and also sort of the discussion around acknowledging the legacy and history, which I think the SDG discussion did a little bit, but or does do a little bit, but I think some relevant points.
Yeah, I think that ties well to some of the conversations we were having here, that there is like a lens of neocolonialism that we still live under, and the way we approach international assistance carries still a lot of that burden, and we need to like get rid of that somehow. And perhaps one of the ways is by changing the way we partner with local organizations and governments. I also think that there's a lot to learn from private sector, but not necessarily the way we're looking at it, because public health has been thought of from a clinical perspective and not from a marketing perspective. And delivering programs that are simple, like to bring a bottle of a soft drink to a community, is simple because it doesn't get bad if it gets too hot in the truck. Like, we have not thought of public health interventions from that lens. Like, how do you simplify it? Because we're so tied to the technology that is required to develop a vaccine. So if we put more effort into training a new generation of public health professionals that can think about this simplification of the delivery of health programs, I think we'll solve a lot of the problems that we've been like hitting a wall with so far. So there's a lot to learn from the simplification that the private sector uses in developing the products and thinking about delivery. And I don't think we're thinking of public health from that lens, and that's maybe where most of the learning can come from.
Okay. We've technically run out of time. I'm going to ask for people's patience, going back to what Michael Messenger said earlier, if you're frustrated because we're not getting to the drill down on the topics. We're at the start of 2 days of conference, so let's hear quickly your comments, and then I'll ask for any sort of quick responses or thoughts to wrap up, and then encourage people to take some of these thoughts away from the session as you go into the next day and a half of discussions afterwards. So.
Sure, I'll make mine more into a comment as well, just like Helen did with hers. But my name's Austin. I'm here with Plan International Canada and also on the Program Advisory Committee, so thank you for your presentation. And just in the essence and the spirit of equitable partnerships, we're chatting at our table, and I can be the youth that asks the question. The age 35, we've heard a couple of times today. We are kind of putting out a call to all of you and all of the work that you do, both internationally and domestically, to recognize that there is an importance to sort of narrow that definition. So the UN uses the age of 24, so about 15 to 24 as young people, and recognizing that between 24 and 35 is sort of losing the integral voice of young people.
That's what we need.
So just in your work to do that, I guess moving forward and recognize that there is an importance to include those voices in equitable partnerships and the numerous demographics of young people within that age and what we and others have to say. And I'll leave it at that, but if anyone wants to chat about an equitable partnership with young people going domestically, let me know. Plan International Canada is doing a project called Youth for Gender Equality that is youth-led, not just people speaking for youth, but youth-led in the spirit of equitable partnerships. So I would love to chat with anyone about that, and thank you again for your presentation.
Awesome, thanks. Okay.
Hi, my name is Beth Payne. I'm a postdoctoral fellow from the University of British Columbia. My work has partly been involved in mobile health design and implementation, and within that space there's the concept of user-centered or human-centered design. And what you were speaking about with equitable partners and the need to be led by the communities, or in my case the users of the technology, there's a lot of consistency in that message. And listening to it, I was just thinking about the main agenda for the meeting, or the main goal for this meeting, which is an agenda for Canadian leadership in women and children's health. And so can you speak very briefly about how you marry the idea of leadership and Canadian leadership with the need to be led in that agenda by the communities and the places you're working?
Yes. Good. And last words over to you.
I'm Brittany Van Dyke. I'm from the Aga Khan Foundation Canada. And I kind of have 2 points, more comments rather than questions, but the first being in equitable partnerships, having real trust in your partners. I think, Josh, you nailed it with we should feel uncomfortable, but I feel like oftentimes we have egos that kind of get in the way of the humility and what we really need in these partnerships, which is the discussion and true listening of the perspectives that each partner brings. The other piece the other thing that I would say is the private sector, going back to that, because I think the innovation is much quicker, and generally we talk, and I feel like they're better at action. And I think we have a lot to learn with that. Diego, you said about the marketing piece. For sure, going from public health, from the social marketing perspective, that has nothing to do with transporting goods or specific items that expire in health services, but there's also knowledge that can go anywhere in any place in this world, and that can't be discounted, especially when addressing the social determinants and that second piece of creating demand for health services, because I think that would drive the demand for actual health services, and then having the private sector supply chain knowledge and actually bringing it there, knowing that there is interest and there's already a foundation for that. So yeah. Thanks.
Okay. Last thoughts or quick responses to those comments?
I will cede my time to you if you want to respond to those.
I'll make one comment on the private sector again, because I think that we and ministers of health plan the implementation. We're going to set up a health facility in an area, and sometimes the population that's going to be serving is makes it completely unsustainable. Like a soft drink or a tobacco company, I know we're using the bad examples, but would never set up a locally, a company-owned store to sell their products in the village. So there's a simplification in that, also in delegating and setting up something that makes sense for the population, and it will be sustainable. That perhaps we're certainly not using that logic when we set up the branches of our health system around, and I don't think there has been much discussion about that.
If I could just, I'll try and keep my comments brief and do two questions with one comment. So the question about how do we provide leadership by and still be led by the population, and also about research as well, local research. So one of the key decisions that we made at one of our the roundtable discussions was that as a group, the voice of the population as expressed by the mothers should be the loudest voice, and that was very unanimous. It didn't come from us, it came from the whole group, that the voice of the mothers should be the loudest voice, and that the needs identified by those mothers should be those ones that we champion. So I think that sort of speaks to that a little bit, briefly, but I beg your pardon. But and how do we translate that voice into something that we can then coalesce around? And I think that idea of local research and local research institutions is absolutely key. Would I have had as much confidence in those consultations being done by an institution from the South? I have to say, not as much. The fact that we had lucky enough to have that QHRC, I am a fan. I don't know if anybody's discerned that. To generate that local research and look at it through that cultural lens, because they were really amongst many voices, they were the ones who were really picking out the cultural complexities and the protective factors that culture can bring in child rearing, and which was really key and really changed, as I say, the way that we wrote our recommendations. So coalescing around the voice, but also making sure that we collect that voice is done in from a local source.
I'm going to quickly thank the three of you for your contributions, for stimulating some really interesting conversation. Thank everybody in the room for equally participating. I think that I would really encourage you to continue the conversation throughout the next day and a half. As Helen mentioned, there will be a report at the end of the conference, so we will pick up the various threads to help inform, I think, an outcome document that will hopefully have some recommendations for Canadian leadership. I heard a lot in the room today. I think all of the different interventions across the range of things from discovery science to scale to intersectionality really reinforce the importance of bringing in lots of different voices to the partnerships to get to where we want to be, whether it's the Southern Cross or the North Star that is guiding us. So thank you all very much. We'll let you all go for lunch, and join me in thanking our panelists.